Lenacapavir is considered a potential game changer in HIV prevention because it is the first twice yearly injectable, meaning that you would get an injection every 6 months that is as effective as daily oral PrEP. And the reason it is a potential game changer is because now it precludes individuals from having to take a daily dose of PrEP, so the daily oral PrEP. It is as effective, and because they no longer have to take their pills daily, adherence is no longer an issue. In addition, one of the main reasons people opt out of daily oral PrEP or tend to skip doses is because there's a fear of inadvertent disclosure if they walk around with a shaking pill bottle, for example. Now with the injection, you don't have pills to take anymore or a shaking pill bottle, and so that extra added level of privacy is what individuals are really looking for. Because by getting an injection, you don't have to worry about adherence and you don't have to worry about anybody else knowing that you're on PrEP. The top 5 things needed in South Africa to ensure the successful rollout of Lenacapavir would comprise adequate knowledge building across the country, both amongst the populations targeted for Lenacapavir use, as well as the healthcare sector and the general population, for everybody to understand what Lenacapavir is, how it works, as well as to dispel any potential myths related to its use. Secondly, it is imperative that communities become involved in both the design and rollout planning of Lenacapavir. So for us to successfully implement the method and reach the target beneficiaries, it is critical that those target beneficiaries are at the table when we talk and design the rollout and implementation programs for Lenacapavir. Thirdly, supply chain is a critical component. If the supply chain cannot adequately meet people where they are, method rollout is not going to achieve the impact that we are aiming for. As such, it is imperative that the method rollout be decentralized and not only be offered within public health settings, because our target populations will not go to the public health settings to access and uptake a prevention method. As such, as with any other prevention method, you need to meet people where they are. Fourthly, it is imperative that we monitor method uptake, rollout, as well as understand how people are experiencing the method, so as to revitalize as well as refine our rollout methods and dynamics to better suit the target population that Lenacapavir is currently aimed for, which are people at high risk, key populations, as well as adolescent girls and young women. And lastly, the individuals should be monitored and reminded for their follow-up injections, because it is important for the method to remain effective that you access your follow-up injections within the right time frame to ensure that you are consistently protected.